Hello and welcome to At the Leadership Table with retired Major General Jim Hoyer. Oftentimes people hear the word leader and they think only of political leaders, but leaders come in many forms, and that's worth exploring. I'm Jim Hoyer, born and raised in West Virginia, a husband, a father, a new grandfather, and a retired military leader, serving for over 40 years in public leadership for our state and nation. Now, the most important mission I have going forward is to educate, motivate, and empower our next generation of leaders. At the leadership table with me today is Dr. Angie Settle. Angie is the Chief Executive Officer of West Virginia Health Right. Angie has served as the CEO for West Virginia Health Right since 2014 and has dedicated nearly 30 years of service to West Virginia communities and healthcare as a clinical coordinator, a family nurse practitioner, and as a servant leader. And I've had the experience of working with Angie on projects over the years to include the work that Health Right does in the community every day, but also Health Right has been an important part of our emergency response efforts across the state of West Virginia and helping with the public health piece of responding to state emergencies. Angie, I greatly appreciate your service to the state of West Virginia in the healthcare field, and it's a pleasure to have you at the leadership table with us today.
Thank you so much, General Hoyer.
So, Angie, I'm going to ask you the same first question that we ask all of our guests. Please share with us a standout moment when you learned something really important about leadership.
Well, I hate to go there, but I have to go there. So during the COVID pandemic, I learned a lot as a leader in terms of planning. That was the moment that you realized all the plans pretty much just went out the window, and really just going with your gut as a leader and following your heart and doing the right thing day to day just kind of drove what we did, and we ended up becoming the number one testing site in the state with over, I think, 140,000 tests that we did in that drive-through lane. But also, sir, just being a servant leader, being out there myself in the lines, doing testing, making sure that our staff got lunch breaks and the nurses got a break, and actually working the line myself. I just think it's really important, to lead by example and to never expect your troops, as you will, to do anything that you can't do yourself, sir. So I think that was a valuable lesson.
Yeah, and I think those are both great and important examples that I've experienced from a military leadership standpoint as well. You plan and you plan, but you understand that it only survives the first contact with the enemy. In that case, it was the pandemic, and
Absolutely.
also you've got to be out there on the front line with the troops so that they see that you're as engaged and you're willing to do the same mission. So I greatly
Yeah, well, for
appreciate.
sure. Like when we were working 7 days a week doing outreach and everything it was so much. And when I look back at it, I don't know how everybody did it, but I think it's important, to be there, like I said, and doing the work as well.
So health right has become a critical element of uh, health in the communities across West Virginia. Can you explain to our listeners a little bit more about the significant number of roles and missions that West Virginia Health Right has across the state?
Well, I've been with Health Right since I got out of graduate school in 1997. And I became the CEO, like you said, in 2014. When I took over, we had about 15,500 patients. It's right as the Affordable Care Act came to be. A lot of people thought, oh, we'll phase out free clinics. We won't need them. But we've really developed over the years to try to react to community needs. And that may be different, whether that be substance use disorder issues or, oral health issues. So we actually, as of today, we have 46,750 patients that we've tripled. We serve people from 34 South Central counties of our state. And we've expanded now. We have 3 stationary clinics in the Kanawha County area, but we also have 3 mobile programs to include a mobile dental program that travels to McDowell, Logan, Boone, Clay, Roane, and Jackson counties. We have a mobile medical program that goes in kind of rural areas of Kanawha County, and then we have that new mobile teaching kitchen, which we'll be talking about. But it's so important to reach people where they are. I'm a lifelong West Virginia born and raised, 54 years, proud Appalachian female. But one of the things that I love about our state is just how close knit we are and how we tend to cling to those hills and hollers and live near our family. But sometimes it's hard to get out of those areas and reach people and get dental care and everything. So what we've really tried to work on over the years is just trying to get where people are.
And I think you hit on a really significant role that you guys play, and that is getting to West Virginians who need access to health care, but also in some cases can't afford health care, and getting
Right.
to them where they're at.
Yeah. So I didn't mention that. So we only see patients without insurance, those with Medicaid or Medicare, because we see those as underinsured, and you have to be at or below 250% federal poverty level. And we never charge patients out of pocket for any kind of care. If they have Medicaid or Medicare, we'll try to bill for whatever service we provide. But otherwise, we don't. Patients never pay, and those without insurance don't pay as well. So we write a lot of grants, sir, a lot of community donations. We have about an $8.5 million budget, and when I took over, it was about 2.1 million. But again, our numbers have tripled. But for every dollar that we get in any kind of donation or grant, we turn into about $30 worth of free health care. And that's because of all the volunteers. We don't have any hired dentists or physicians. They're all volunteers from the community, surgeons and family doctors, dentists that and then of course WU, Thomas, and then CAMC donate a lot of free lab services, x-ray, surgery, etc. to our patients that are uninsured. So altogether it's about $28 million worth of donated care that we provide every year.
So it really is a community-based effort
It
to
really
take care of
is. It
people.
is. It's not just us. The big base of what we do is our volunteers.
So we've talked a lot on this podcast recently about food security and how
Mm-hmm.
important it is to address food security issues in the Mountain State and
Mm-hmm.
our communities, as well as around the nation. We've had representatives from food banks, some other programs like the Healthy Kids program that's focusing on food as
Mm-hmm.
medicine.
Right.
So you mentioned the mobile teaching kitchen,
Mm-hmm.
which I think is helping to bridge that gap between the security piece, but also food as medicine. So
Mm-hmm.
tell us a little bit more about the mobile teaching
Sure.
kitchen and why it's so important.
So, at our stationary sites in Charleston, we have one on the east end and one on the west side. We have 2 large teaching kitchens, and the whole focus is trying to teach people, food as medicine concept, how to treat their diabetes, their high blood pressure, obesity through what they put in their mouth. Trying to teach people how to, shop on a budget and come out with healthy food, because we know how hard it is sometimes to produce a healthy meal on a budget. It's terrible, but healthy foods typically cost more. So we teach people how to do that, how to use, different herbs and stuff to make things taste better. Because, like I said, I'm born in Appalachia, and one thing we're great at is if anybody has a tragedy or anything to celebrate, we love to cook for you. We love to bake for you. So just teaching people how to do that and do it healthier. So what the teaching kitchen is basically taking that same concept, that winning concept that we've taught in our classes, and just taking it on the road, going to non-traditional settings. One of the places, I think it's called the Golden Delicious Fair in Clay County.
Mhm.
We went to really remote areas of the state with it, things where you would typically think you wouldn't see something like that. And we pull up and we're basically, showing people in a live demonstration how to cook healthy foods that taste great, something easy. We had a great win with one. I had a lady reach out and she was trying to get a recipe because she was doing a baby shower for her daughter after the fact. And she loved these chicken wraps that we did. And she thought they were so tasty. And she tracked us down because she'd lost the recipe. But so a lot of things like that. We do things at church events, live on the levee in Charleston, different places like that. And, people naturally assume it's like a food cart, like we're selling something, but it's not. It's basically showing people how to do things and how to do them healthy. But along with that, we do, blood pressure screenings, BMI screenings. Sometimes people don't realize what their BMI is, or just by moving that number, down a few digits, how much it can really impact their health. Along with that, we do like the recipe and just some basics, healthy tips for, getting active and things like that. So that launched. Actually, we had the ribbon cutting. I think it was June, May or June at the governor's mansion, because that's been something that he's believed a lot in. And since then, we've been doing a lot of different fairs and festivals. But recently, where there was like kind of a crisis with SNAP, where the government shut down, we used it and did an outreach with one of the local churches where they were doing food boxes, and we actually took some of the ingredients of the food box and then showed them how they could prepare that healthily with some healthy menus, and did that along with it, and did a food distribution as well. So we try to use it in that aspect as well.
So the response to the mobile kitchen, has
Mhm.
it been pretty good, pretty
It
robust
really
so far?
has. It really has. I wish we had, five of those, because we've been asked to go to so many places. We're just constrained by staffing and, financial constraints and things like that. But it's been great. The response has been wonderful. People have been very receptive to it. And, first people were kind of like, that first heard the concept, like, wait a minute, how are you going to pull up beside of that fried Twinkie cart and actually get anybody to pay attention? But it's been wonderful.
Mhm.
People are really open to it, and especially the concept of how to do it quick. I'm a mom of 8, which we won't go into, but I have 6 bio and then 2 that I adopted. But I mean, I am in a hurry. We're trying to make meals, we're trying to do stuff fast, so you don't have like hours to spend in the kitchen. So things that you can do healthy, and prepare, in the evening and things like that. It's really important, and showing people, hey, you can do this. And we've had a great response. It's been great.
And, and in these communities where we have food
Mm-hmm.
insecurity or food security issues, and in some cases, food deserts, meaning we don't have
Right.
grocery stores anymore, it becomes even more important to understand how to cook
Absolutely.
healthy from that food as medicine construct.
Now we've also paired it a couple times. I don't, Chef Paul Smith, he did one here on our at our East End site, but we also did one at West Virginia State University, where we partner alongside of a like a food mark, like a produce store, and they'll pop up. We did it with Grits Farm, and they'll have the fresh produce, and then it's actually shown. Okay, here's what I'm going to use, and then they go over and they cook it. So it's pretty neat to see that kind of farm to table concept too.
So you mentioned that if you had more assets, you could get out and there's more
Mm-hmm.
demand. So if somebody wanted to donate to the mobile teaching kitchen
Mm-hmm.
concept, or somebody wanted to volunteer, how do they reach out to you to be a part of that?
Absolutely. Well, you can feel free to call my phone directly. It's 304-414-5931, and you will get a call back from me. I don't have a secretary, so it'll be me calling you back. That's my direct line, 304-414-5931 here at West Virginia Health Right. We would love to have, volunteers. Of course, people, if they want to donate, they can specify what program, to donate it to. We have so many worthwhile causes here at Health Right, from behavioral health to oral health and all the things that we talked about. But we would love to have more volunteers. That's the backbone of what we do here.
And for those who'd want to participate in the training,
Hmm.
how do they reach out and find out when there's going to be
Yep.
one of the classes at the fixed site
Right. Yeah.
or one of the others that you may have
Yeah.
mobile?
So that's on our website. But again, you're always welcome to call me, and I'll connect you with the right person here on our staff. It's wvhealthrate.org, and it's pretty robust. And if you go through, it'll give you each site and give schedules and all of that. But again, you can always feel free to call me, and I'll connect you with the right person. We have that great program, Prep to Serve Appalachia, with Chef Paul, where we're training people. A lot of them in recovery are getting back on their feet, where they're getting into training and he's helping place them in jobs, actually in his restaurants, and that's a wonderful program. We've had really big success with that, and we're getting ready to start another cohort here about the second week of January. So we're always looking. That's a totally free program. You come out with certification within 3 months. It's like a month with him, and then 2 months on the job. So it's really unique program. You come out with certification with Chef Paul Smith, and pretty neat program as well.
That is a great program, and Paul is a great ambassador for West Virginia and a
Yes,
great example of West Virginian giving back
absolutely.
to our
Absolutely.
communities.
He's wonderful.
So, so you guys play an exceptionally important role across, as you said, a number of counties in
Hmm.
West Virginia, serving an underserved population. So, last question for you:
Sure.
what's your vision for 2026 for West Virginia Health Right? What do you want to see next year going forward?
Well, about a year ago, we just finished the expansion on our East End property. We'd been in the same space all of these years since 2000 and really didn't have space. So we got that done. That was a huge project and fundraising effort. Really, to be honest with you, if we can just maintain, sir, and it's really a struggle every year to meet budget and keep fundraising and writing enough grants. We write about 50 to 55 different grants every year to meet budget, where we don't charge patients for care. So every year that's a challenge trying to maintain. I treat my staff like, my extended family. So I make an obligation when we hire people to keep them on. So really, sir, just keep doing, what I consider God's work here in the hills and hollers of West Virginia. It's our mission field, and keep doing that good work. And something always pops up. We want to, when we had the gas crisis on the west side, or there's a fire or something locally and people lose their medicines, we just want to be able to respond. And my prayer is that we just stay here, stay faithful, and keep responding to the need.
Well, Angie, I greatly appreciate you coming on. I appreciate the work that you, your staff, and your volunteers and your donors do, because it takes that whole community of people to serve
Absolutely.
our fellow West Virginians who need the assistance. I have seen you firsthand on the front lines of the pandemic response, the flood response, other emergencies, as well as serving the communities day to day. So I thank you, your staff, your volunteers, and your donors for your service. And thank you for joining us at the leadership table today.
Well, thank you, sir. It's quite an honor to get an invite from General Hoyer.
Thanks for listening. This has been At the Leadership Table with retired Major General Jim Hoyer. Did you know you can now find me on social media at RMG Hoyer? That's HOYER, or email me at rmgjameshoyer@gmail.com.